Hi there, I'm Nicole Bereolos. I'm a clinical psychologist and a certified diabetes educator. I'd like to thank you for joining us for this edition of Facebook Live. Today, I'll be discussing the topic of diabetes, cardiovascular disease, and kidney disease as they specifically relate to women's health. To do this, I've enlisted the help of Ms. Jayne Wallace. Before we begin, I'd like to add that this program is being held in conjunction with the National Kidney Foundation, Diabetes Sisters, and Women's Heart, the National Coalition for Women with Heart Disease. So we know that diabetes, cardiovascular disease, and chronic kidney disease are all very much related. For women specifically, we know that having diabetes increases your risk of having heart disease and kidney disease. So it's important for women to try to do their best in managing all aspects of their health, not only from diabetes, but from weight, cholesterol, and also very importantly, stress management, mental health, and also sleep hygiene. So in order to do this, people find various ways in order to accomplish holistic health. Partly, people will do this by trying to get help from a variety of healthcare providers, dietitians, nephrologists, primary care physicians, clinical psychologists, certified diabetes educators, OB-GYNs, many other healthcare providers. And that is something that Jayne Wallace has done. She has been living with diabetes for over 20 years. And her journey has started taking medication like many people who have been living with type 2 diabetes.
Absolutely.
But more recently, she has taken on a very, very important challenge. She has significantly altered how she has eaten,
Yes.
specifically protein intake and also carbohydrate intake.
Yes.
Very much reduced her carbohydrate, increased protein, and has lost a significant amount of weight. So I'd like Jayne to talk just briefly about what she has done over the past few months. Jayne?
Thanks, Nicole. Yes. First of all, I have a team of doctors, number one. I've enlisted Nicole in a dual role. I've also been working with a bariatrician who helps me through the science of weight loss. And we are restricting net carbs, very limited carbohydrate intake, limited caloric intake, watching my vitamins and supplements. We're treating everything that goes into my body as an integrated plan, looking at my food, my medicines, even my vitamins as a holistic, balanced, coordinated effort for the betterment of my metabolism. And that's what really helped me finally conquer this beast called diabetes. And it's a 20-year battle. Over 20 years. And since May, I've dropped, I guess, around 65 pounds. It's a very, very structured, closely monitored program with my doctor.
And this has allowed you to reduce a majority of your medications, has it not?
Absolutely. I've been taken off insulin and reduced some of my other medications that I've been on, diabetes meds and some other medications that I've been on. So I'm very excited. I feel a lot better, a lot more energy, and it's just changed my outlook on life because now I feel I'm in control rather than the diabetes being in control.
And I remember something you had mentioned in our recent meeting. This was kind of the lowest weight you have seen since childhood.
I don't even remember my weights from high school, but I want to say 9th grade, maybe? 9th grade. So it's significant. And I was FaceTiming with my sister, and she's looked at me and says, she didn't recognize me. So it's huge. It's huge.
Probably healthier now
yes.
than perhaps you were as a young adult.
And it started with the willingness to make the changes, the willingness to accept that I had to make a change. I could not do it by myself. I had to rely on professionals who understood these diseases better than I did take their advice and live by it every day. And raise my hand when it was time for help.
So we would probably granted to say that from a cardiovascular or heart point of view, from a kidney health point of view, your health is much better now than it's been.
Correct. I've been fortunate along my journey, knock on wood. No one has ever questioned any of my kidney values, although I've had the tests. Kidney disease, sadly, my father died from kidney failure. My mother died from heart disease related to type 2 diabetes.
Yeah.
So
thinking back from when you were first diagnosed with diabetes, what advice would you offer to women who are newly diagnosed with diabetes?
if I could have done it over again,
Yeah.
I would have paid attention when I was told I had a little bit of sugar and monitored the meal plans a little more closely. I would have asked more questions rather than just, okay, take the prescription, go to the doctor, go to the pharmacy and get it. I would have been more proactive, asking more questions. What does this medicine do for me? I would have looked at all medications. Again, as I said earlier, the medication in conjunction with whatever goes into my mouth has to work together to make my body, because it all goes into the same place. You've got to work together to help your body work as the machine it's made to work as.
So what I'm hearing is you'd be very much a more informed
Correct.
patient living with a condition.
Yep.
Yep. So throughout the years, what toll has living with a chronic condition had on you physically, socially, and psychologically?
Well, socially, it was very limiting as far as, I mean, I was obese.
Sure,
I still am, according to the charts, but I was morbidly obese.
Yeah.
Didn't go out much, so you have that whole psychological burden.
Right.
Didn't go.
Well, burden and stigma.
And the stigma.
Yeah.
So add all that thing. My career, I would say, took a few hits because of it. As far as having energy, just not thinking clearly throughout the day. It's hard to verbalize. Right now I'm thinking just every moment of every day, really, just not having waking hours, coming home feeling exhausted, not having the energy to do things I wanted to do. For example, this morning I got up and I just said, what the heck? I was up early and I walked and walked and walked. And I just kept walking. And I realized how far I walked and I was like, wow, I hadn't done that in forever. But I had the energy to do so. And I haven't done that in forever. So that's what feeling healthy feels like.
So in the past, having these conditions was very life-encompassing.
Exactly.
Is
and
what
limiting.
I'm hearing, limiting.
Limiting.
Do you think it affected other people in your life?
Oh, absolutely. There were times when my nieces would come to visit, I didn't have the energy to do things.
Yeah.
I didn't want to go for a walk or go to the playground, ride a bike. I remember buying a bike with the intention of riding it. Remember, it got all cobwebby and dusty. And
It's like buying that gym membership, right?
exactly.
Just to say you have that
I had one of
card.
those too.
Did you?
I had one of those and I never used it. So
Right.
And it expired. Things of that nature. But it was, the intent was there, but I never had the energy to take action.
Yeah.
So now that I'm feeling in control, I can make more choices.
It's almost like I'm hearing you've got your life back to a degree.
I don't know that I ever had it in full control.
It's amazing.
It's like I have my life now. I don't know that I ever had it before. So,
Unbelievable.
and it's just the matter of having that decision to make a few choices.
Yeah. Any other thoughts you have for other women out there living with conditions, chronic conditions?
My big trigger point was something really basic, and my big thing was I found that artificial sweeteners were a trigger for me.
Okay.
And you think you're using artificial sweeteners because they're not sugar.
Yeah.
Well, in my case, artificial sweeteners caused me to crave more sweets, which caused me to crave more carbs, and it was this vicious cycle.
Yeah.
So once I made the decision to stop the artificial sweeteners, it was a major change to not have them, but once I got over that, the rest was easy.
Was that a conversation you had with one of your physicians?
Yes,
Okay.
it was with my my bariatrician.
Oh, okay.
So it was just, again, a change.
Out of curiosity, did you bring that to the table or did he?
No, it was part of his discussion when I came to him as
Oh, interesting.
under his meal plan.
Interesting. I know that's a specialty that often gets ignored because you think of a beriatrician, you automatically think of surgery.
No, he does not serve.
But he does not
surgeon.
provide surgery.
No.
Right, right. Okay. Well, at this point, think we're going to take questions from the audience. So if you've got questions on this matter for either myself or for Jayne, please post it in the comments section and we'll try to answer as many questions as we can. So a few of the questions that we have received is, can diabetes, heart disease, or kidney disease impact pregnancy? Very important question. So pregnancy is obviously a very critical period. Women who do live with diabetes, that's either the woman has it either before pregnancy or develops it due to pregnancy, called gestational diabetes. That woman needs to have very frequent visits with their healthcare team. Very close monitored. They often have to have new prescriptions brought on board during their pregnancy and additional tests because of safety for not only the mother, but also the unborn child. Because the pregnancy itself is going to put additional stress on not only the heart, but also the kidneys themselves. So during that critical 40 weeks, the woman wants to make sure she has the utmost prenatal care during those 40 weeks of pregnancy. And even if you can have preconception care, planning for the pregnancy, that is the best for someone trying to have a child. Second question is, if I have kidney disease, do I have to worry about bone health as I get older? Regardless if you have kidney disease or not. Every person, male or female, but particularly for women, you do need to worry about bone health because our bone, the thickness of our bone, the strength of our bone does decrease as you get older. So most women, it should be part of your primary care physician's appointment. You should be getting bone scans and other tests to check for osteopenia, which is a precursor to osteoporosis, and also obviously for osteoporosis, and also checking your blood levels for different vitamin levels, calcium, iron, just making sure you're getting the proper nutrients through your diet, through what you're eating, and then that can also be augmented either through a multivitamin or through prescription vitamins that your doctor can prescribe, and also meeting with a dietitian who can make specific recommendations and perhaps things that you're not eating that maybe you need to add to your daily intake. Next question is, I take hormone replacement therapy. Should I worry about heart disease? Again, very important question to have with your physician. There's a lot of research about hormone replacement therapy. Often you'll see the term HRT as an acronym. That's a very specific question you need to have because it's going to be very individualized with your case, because the research is going to go based on your family history with different cancers and increasing the estrogen in your body from the hormone replacement therapy. So very much is going to depend on your family history, your own medical history. So that's going to be a very specific question that you're going to have, and also with blood clots. I mean, it's a very complicated question, and it's really important that you talk with your physician about those concerns that you have with regards to hormone replacement therapy and heart disease. So we get a lot of questions regarding lifestyle, food intake, what kind of foods are healthy, what's not healthy, what can we eat in trying to prevent diabetes, kidney disease, heart disease. So the best advice that I can give is looking at the balanced plate method. So the government, I think it's myplate.gov, gives great recommendations on how to divide your plates into where you have leafy greens in a majority of your plate, and then the next section you have your protein, and in the next section you have your carbohydrates. Now, if you have advanced stages of kidney disease, again, you're going to have conversations with your dietitian who has additional training in working with people with kidney disease, and also your physician, your nephrologist, about what your limitations are with protein. Because you don't want to have too much protein because of some of the filtration that the kidney does. You don't want to overburden your kidney if it's already got some complications because of kidney disease. So be careful about protein intake. But again, have those conversations with your healthcare team. But in general, if you want to try to maintain a healthy diet to try to prevent some of these conditions, limiting highly processed foods, limiting artificial processed sweeteners, like Jayne said, that's been very successful in her journey. Healthier grains, quinoa, couscous, things like that can be very good as opposed to the fluffy white breads, potatoes that are very starchy, bagels, croissants, danishes, and choose things that are full more of whole grain when you do choose carbohydrates. So leafy greens, whole grains, and then your lean proteins like your red meats that end in loin, and also salmons, other fish, lean chicken, pork, all those things will help you give your balanced plate. And also throwing in some low-fat dairy, perhaps a Greek yogurt, 2% milk will help you give a balanced plate just to make you healthy, to try to prevent cardiovascular disease, kidney disease, and diabetes. Again, these are modifiable risk factors. These are things that you have control over.
And if I might interject.
Please, oh please.
It's not that difficult to do. They're not difficult changes. And this is from someone who's been there, done that. And even with my father, who was on dialysis, to cook without salt is not that difficult. It's just different. So please, when you're sitting with your doctor, if you are diagnosed with kidney, they'll give you the book. Don't be afraid of it. Just take a moment, read through it. And it was quite tasty.
Yeah.
And so don't be afraid of it. It's just different.
Oh, cooking with herbs.
Yeah, that's what it is. They give you the recipes. It's not bad. The Kidney Foundation rocks,
salt substitutes. There's other products out there. And even if you dine out a lot, restaurants are very accommodating.
Exactly.
If you want, no bun or something on the side, or take the sauce off, they are 9 times out of 10, they're more than happy.
Yeah. But my point is, though, don't be overwhelmed. It's just different.
In making small changes.
Exactly.
You don't have to go from everything to the book, follow the book to the T.
Exactly.
Not by any changes.
That's why you need your team.
Well, and they're all going to give you tips.
Exactly.
You're going to learn something from each part of the team.
Exactly. So don't be weird.
Yeah. So another question we received is menopause an issue with heart disease, diabetes, or kidney disease? Well, menopause really, I hate to say it, but it's the puberty of later age. It's when you have an influx of all these changes. And for women, it could happen as early as their 30s, or it could happen in their 70s. We don't have a straight answer. So because there's going to be all these changes going on in the body, hormone changes, insulin levels are going to be changing, estrogen, testosterone. Women, you have testosterone. It's important. You need it. Trust me. It's important to get tested on your testosterone levels, and don't be ashamed to ask about your testosterone levels. And men need to be asking about estrogen levels as well. But because all these are in flux, It's going to change your blood sugar control. It's going to change how you feel. It's going to change your symptoms of high blood sugars, low blood sugars. It changes how you can manifest or show signs of a heart attack. So being aware of common signs and symptoms of a heart attack for women, very different. You know, jaw aches, feeling tired, feeling, fatigued, low energy, very different than classic for a man when you have that, shoulder pain and arm pain. So being aware of how things are different for men versus for women. So, a question that came up for you, medications, a lot of us take medication on a daily basis. Mm-hmm. Any suggestions on how to remember when to take those?
Well, that's a good one, because I was struggling with this in the beginning. Remember I said you had to have a team? Add your pharmacist to that team. Registered pharmacist, and always go to the same pharmacy. And even if it's one of those mail order pharmacies, you can ask to speak to the pharmacist. Yep. Let them know everything you're taking, even the supplements, like if you're taking the brand name multivitamin. And then help them, they'll help you write a schedule. And then there's one that I have to take before breakfast. So then they suggested, well, take that one when you brush your teeth and then take your shower. Then you go have breakfast. And it just gets into a routine. And then there's one you take before lunch. Well, you set a reminder on your phone. And yeah, I've got one of those trays that breakfast, lunch, dinner, and it just became a habit. And it was a change, and you focus on a habit, and after a couple, 2-3 weeks, it becomes a habit. Yeah. And you don't think about it.
And don't beat yourself up if you miss a dose.
Well, you've got to pay attention with your pharmacist of which ones you can miss and which ones you can't. If you miss your multivitamin, not so big deal. But if you miss taking insulin, that could be a big deal. So you've got to watch.
And have a backup plan.
Yeah, have a backup plan. But
very important.
Work with your pharmacists and your medical doctors. But they'll help you with the schedule. They're there to help. Yeah. That's what you're paying them for.
And you have to ask.
Yeah. You're paying, or your insurance company is paying their salary. Ask them. That's good.
So another question that came up, and I alluded to this a little bit, is are there differences in risk between men and women when it comes to diabetes, heart attack, stroke, and kidney disease? So in general, men tend to be at higher risk for diabetes and heart attack, but when you add diabetes into the picture, it actually does flip. And women do become more at risk to develop heart attack and diabetes, or heart attack and stroke. But again, if women take better care of themselves, do like Jayne did, kind of take on this team approach, tackle some of these barriers she had been living with for all these years, she can then lower her risk like she's done for these two important issues. So taking it piece by piece, what can she, what can women do to address these challenges? Not take this big storm and try to tackle the whole storm, but break it down into doable tasks, one by one. Lay it out. You've got these 20 different things you want to tackle. Number one, what can I do about it? Address the barriers. Okay, we've got that. We're doing well. All right, let's tackle number two. Break it down. What can we do about it? Don't try to do it all at once. Set yourself up for success. Might as well be your best champion.
Right, and I'd also try to find someone who would be a good support or an ally. Mm-hmm. And I'm giving a plug to Diabetes Sisters. But it's true, because someone, and I didn't know about the group until I was approached through this program, but having a resource of women facing the same challenges, had I known that group existed 3-4 years ago, would have been a great help along this journey. But yet I'm paying it forward because everyone out there now, diabetessisters.org or something, mm-hmm. And it'd be amazing, because women are known to be more social when we're dealing with a problem, where guys will internalize it and figure it out in their head and then deal with it.
Because having a variety of support is important, because you don't want to overburden one or two people.
Exactly.
So having that, again, it's that team approach, really. Yeah. So I don't think there's any other questions. So I think we've run out of time. So I want you to check back on the National Kidney Foundation's Facebook page, where they'll be posting the answers to other questions that come up throughout the days. And remember to tune in to March 28th for the next video in the series. Now, on behalf of our partners at the National Kidney Foundation, Diabetes Sisters, and the Women Heart Organization, I would like to thank you so much for watching. I'd like to say thank you and I wish you all good health.